Hello, my name is Leslie, and I'm the treatment coordinator at Elan Implant Center. I come to this position after 23 years of dental assistant experience, so I have a lot of clinical experience with this. I worked as a dental assistant at the other practices, and then when the treatment coordinator position became available, I jumped at the opportunity because it just seemed like such a fun position to do, to be able to help people with their long-term goals and, restoring their dental health. When you come in to see me, I will take some x-rays on you, have Dr. Moeller review them and let us know what he's recommending for you. Once he tells us what he recommends, I can get a treatment plan together for you. We do a wide range of services here. We specialize in the All-on-X treatment, which is the full mouth implant prosthesis. And I can typically answer most questions that people have because of my clinical background. So when my patients come in to see me, no matter if it's been a long time since they've been to the dentist or not, I know it can be very nerve-wracking for patients to sit in a dental operatory chair. So I take my patients into my consult room where we can sit and discuss things and figure out what's going to be best for you. I try to make you as comfortable as possible because it's not my job to judge what happened in your past. It's my job to make sure that we can get you on the road to a beautiful, healthy smile and go from there. So I do everything I can to just sit and listen and try to find out, the best options for you and make sure that you are comfortable. And so we start in the consult room where it can be a little bit more comfortable, just a one-on-one conversation to explore your options and figure out what we need to do for you. I'm a very visual person, so I love to use my models to show people what the treatment is, but I also use the x-rays to show them what we're seeing and where we're seeing it and how it's going to or why it's determining what you need done. If you need financial assistance, we do have 3 financing companies that we work with, and if they cannot help you or get you the rate that you need, I always recommend to people, credit unions are great to work with, so that is definitely an option. I've known some people that use 401k to do it. I've had someone do something as much as sell a motorcycle to be able to come up with the funds that he needed to cover the cost of what he needed done. I can sit down with you while you're in office with me and get you pre-qualified. And the nice thing is the companies that we use, they don't do a hard credit check. It's just a soft credit check just to find out if you qualify with them. But I can definitely walk you through that and help you. And if you are struggling with your own credit score not being great and you have someone that can help you, we can also have a cosigner with a lot of those financing companies too. They are willing to work with the patients in that aspect. Once we determine what you need and find out the cost of the treatment for you and get all that taken care of, we would just get a pre-op scheduled typically. It depends on what you need, but if we're looking at the All-on-X cases, we start with a pre-op, and that's typically done 3 to 4 weeks before the surgery date. All of our surgeries are done under IV sedation. We have a nurse anesthetist that comes to us from Ann Arbor. He's very good. He's got lots of experience. He sedates the patients because we do all of these surgeries under IV sedation, which I believe is good to have a nurse anesthetist in here for the patients because then the doctor can focus on the dental aspect and the nurse anesthetist can do the sedation aspect, and everything is safe and done to the best of our ability. So when it comes to dental pain, I've always told my patients, like I said, I've been doing this for over 20 years. I've always told my patients, every patient's pain level is different. Everybody experiences pain differently. So it's hard for me to say exactly what you're going to feel, but I do know that we are here to help our patients through the recovery and the healing process. We provide our patients with prescriptions that are needed to help the healing happen, like antibiotics and pain meds. We make sure that we do what we need to do to help our patients through. But also, if there's something goes wrong and you need to come in and see us for an adjustment, come on in. We'll get you on the schedule. We'll make sure that we are doing things right by our patients. I myself have had a dental procedure done under the IV sedation, and it was a great experience for me. It's very safe. And I always joke around that it was the best nap I ever had because I just woke up and everything was done and I was good, and I would do it again. So after you get your surgery, you will go home with just the implants in, and then you come back to us the next day after the lab fabricates your first set of teeth. And the first set of teeth is a healer set just to get you through the first couple weeks of healing. And then we get you a long-term set of healing teeth. And the reason why we do this is because we want to get the best aesthetic from this procedure. And by letting you have that healing time before we do your final teeth, that's how we get, the best result. We get the best function out of them, the best aesthetics out of them, and it just is a better result than I've seen at other places that I've worked in the past. So after that healing time, you come back and we'll start your case planning for your final teeth. This is where the patient gets to be a little bit more particular about things. If there's a shade that you don't like, we can definitely get that handled. They can adjust things for you to make sure that you're happy with the shade of the teeth. If there's a certain shape of a tooth you don't like, those are the kind of things that you get to be particular about. And Dr. Moeller will take this time to make sure that the teeth are engineered correctly so that they are functioning for you at the best. We want to make sure your bite is good. We want to make sure when you're talking, you're not lisping. We want to make sure that when you're chewing, you're getting good, even chewing out of them. All those little things he looks at and make sure that they are done very well. And then once you're happy and he's happy, we will deliver the final teeth, and then we give our patients a bite guard because this is an investment that you're making in yourself, and we want to make sure that it's protected. And the bite guard helps with that. It helps keep patients from grinding and causing damage to the teeth while they're sleeping. We also do things like provide a water pick for our patients so that you can keep those implants clean and healthy by flushing away the plaque and bacteria that can accumulate in those small areas. And then we do recommend our patients still get the teeth cleaned and brush the teeth twice a day like they are your natural teeth. Just treat them like they are your natural teeth. And then if you do have your own dentist, go see them, get your cleans done twice a year, and then just come back and see us for yearly exams for the first 3 years or so after you have your final teeth in. And I always tell patients, if you don't have a general dentist, we do have a hygienist here that can do that for you. So we are always welcome to have patients here. We stand behind our work here. I'm not here to sell people treatment. I'm here to help my patients with their oral hygiene and make it better for them. I'm not pushy. I'm not a car salesman. I'm really just here to help get you on a better dental path.